Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs. All right, welcome everyone to today's program, Over-the-Counter Options in Oncology, featuring Kelli McCrum with Northside Hospital Cancer Institute. I'm Katie Armsby with Cancer Support Community Atlanta. If this is your first time joining us, we welcome you and invite you to visit our website, cscatlanta.org, where you can see a complete list of the virtual and in-person oncology programs that we offer. These programs include support groups led by licensed mental health professionals. We have stress reduction classes like yoga and Tai Chi that also meet. We also have a new introduction to breathwork technique class that also meets, a nutrition seminar facilitated by Kristen Kukolowski, and we've also added a new monthly nutrition seminar for those newly diagnosed to prepare them for eating and nutrition during treatment, and of course education programs like these. So again, for more information, we invite you to visit our website, cscatlanta.org. I'm excited to welcome today's presenter, Kelli McCrum. Kelli McCrum is an oncology clinical pharmacist at Northside Hospital Cancer Institute. She obtained her PharmD at the University of Georgia, then completed 2 years of additional residency training in order to specialize in oncology. Kelli previously worked as a bone marrow transplant clinical pharmacist and has recently transitioned roles to the Outpatient Oncology Clinical Pharmacist. So with that, welcome Kelli, and I will pass it off to you to begin today's presentation.
All right. So we have a full agenda today for this course. Today, I will be discussing common over-the-counter medications and potential issues, how to approach the over-the-counter dietary and natural products. It's important to realize the difference between medications and dietary or natural products. We will discuss important considerations when deciding on a product. I will review the safety and effectiveness of dietary and natural products and go through some possible interactions. Some of these interactions will include herbal products in oncology, where I'll discuss how herbal products may affect the efficacy and safety of your anti-cancer medications. I will walk through antioxidants, vitamin D, and turmeric specifically. I'll discuss the role of herbal products in mitigating chemotherapy adverse effects, touch on some herb drug and herb disease interactions, and finally, I will provide some resources so that everyone knows where to go to get additional information on specific products that you may be taking. It's always important to know resources and where to go to look for the most up-to-date information. You'll notice a recurring theme throughout this presentation to always consult your healthcare team. So if you take one thing away from this presentation, just remember to always consult your healthcare team if you have any questions. So starting off, one concern with over-the-counter medications is that there, in some instances where OTC, which is over-the-counter, medications can mask or possibly exacerbate a more serious issue. So many anti-cancer medications can weaken the immune system. So the risk of infection is very high. While immunosuppressed, the main way that your body is going to let you know that something is not right and there may be an infection forming is through a fever. So a common concern while taking acetaminophen, or Tylenol is the brand name, is that a fever could potentially be masked and your body will have no way of telling you that something isn't right. So also keep in mind that Tylenol can exist alone or as an ingredient in a combination product, such as many over-the-counter cold and flu medications. So typically, we tell patients that Tylenol should be avoided during your anti-cancer treatment unless your provider, which is your physician or your mid-level pharmacist, okays it. The next category is non-steroidal anti-inflammatory drugs, or NSAIDs. And this is stuff like ibuprofen. So these are also typically avoided during chemotherapy treatment, as these medications have some blood thinning effects and can also irritate your kidneys, which we don't want to happen while you're on a chemotherapy medication. Antidiarrheal medications like Imodium should not be taken until evaluated by your physician. And the reason for this is because new onset diarrhea can sometimes be indicative of an infection. So before you start an antidiarrheal medication, which can potentially make that infection worse, you need to be evaluated by your provider. Diarrhea may also be a side effect of your chemotherapy. So if it's extreme diarrhea, you may need a dose reduction, or something else may be going on. So we would want you to be evaluated by your provider before you start taking an antidiarrheal medication, and then once assessed, determine if that's okay for you to take. All right, so over-the-counter medications can be categorized in different ways: medications versus dietary or herbal supplements. So first, let's consider how things are or are not regulated by the FDA. So starting with medications, which would include the agents that we discussed on the previous slide, like Tylenol and ibuprofen, the FDA requires that clinical trials are done to show that the medication is safe and will have the proposed clinical effects. This occurs before a medication can go to market. So these clinical studies are done before the medication is put on the shelf. Dietary and herbal supplements are treated more like food products. So this means that they do not have to prove their effectiveness before they go on the shelf. So these are self-regulated by the manufacturer. The FDA will only step in if there is an issue. So the best way to think about this is medications are considered unsafe until proven safe, while supplements are considered to be safe until they're proven to be unsafe. So next, I'm going to talk a little bit about drug interactions. So although medications and supplements do differ, they are processed through our bodies through similar routes. While you may have more than one agent being processed by the same route at the same time, there can be interactions between these different products. So it's important to know that you can be on many different medications and have no interactions. But to be sure, this is where your pharmacist, physician, or other members of your healthcare team need to be informed about everything that you're taking, so that we can check for interactions and determine if these interactions are insignificant or significant. And this is really important. I always like to point this out because sometimes I've talked to patients and asked, what medications are you taking? And they'll list out their laundry list of meds, but then when I ask, oh, well, are you taking anything over the counter? They're like, oh yeah, I'm taking X, Y, and Z, because sometimes people forget to mention those things. So always, when your healthcare team asks you, what medications are you taking anything over the counter? Go ahead and tell them everything you're taking, including Tylenol, any vitamins, supplements, anything like that. Okay, so a little more about drug interactions. So by definition, a drug interaction is the effect of one product, whether it be a medication or a supplement, on the activity, toxicity, or metabolism of another medication, herb, or supplement. So this includes taking a medication while having certain medical conditions. That can also be considered an interaction. So products, like I said, may be metabolized the same way through your body. So they end up competing for those metabolism sites, and they affect the enzymes that may metabolize the other medications. The most common pathway that you may have heard of is something called cytochrome P450 pathway. So this is one of the major pathways through your liver that medications and other agents are metabolized. So if you ever come across that term, it's referring to a major metabolic pathway, and that's the reason for many drug interactions. So if you ever hear this is a cytochrome P450 medication, that should kind of ding in your head, oh, there may be some drug interactions. I definitely need to talk to my healthcare team about this. So when discussing drug interactions, it's not always as easy as agent X and agent Y interact. There may be many different things that need to be taken into consideration. So these are all the things that are considered when determining the potential level of exposure a patient may have when taking a specific drug product. So first, patient-specific factors like genetics, age, gender, disease state, organ function, and diet are all taken into consideration. And then second, which herb or supplement is the patient using? Was this product put through quality control is a question that we ask. And I'll get into that a little bit more here in a second. And then dosage can also make a big difference. And how long has a patient taken this particular medication? The route of administration is also important. So whether a medication is given orally or intravenously can determine if an interaction is present. So those are all things that are considered. So for example, if a medication may be given orally, it interacts with one of the other medications, but when given through the IV route, it doesn't pass through those same metabolism sites, so it may not interact. So again, things that are all considered. Okay. So patients receiving anti-cancer treatment have to be extra diligent and cautious about herbal and natural supplements because there's so many different aspects to cancer care, such as other medications, surgery, radiation, etc. There's a lot going on in the treatment of a cancer patient. So supplements have the potential to interfere with these treatments and do have the risk of serious side effects, such as cardiovascular issues like increased blood pressure, heart attack, stroke. Some other potential side effects include nausea, diarrhea, constipation, fainting, headaches, and seizures. All of this to say, it's extremely important to loop in your medical team with any changes. So if you start taking a medication that was deemed safe, but then you start experiencing side effects, definitely let your physician know right away. And again, don't start taking anything without consulting your healthcare team, because like I said, there can potentially be a lot of different side effects that could happen. Okay, and this presentation is not to paint all supplements in a negative light. There are some needed supplements and they do have their place in maintaining our health. So for example, folic acid in pregnancy is extremely important to help prevent birth defects. And then vitamin D is very important because most of the population is vitamin D deficient, but we'll discuss vitamin D a little bit more in a future slide. So how do you know which product to purchase? And because there are multiple brands out there. So it's always important to look for a few key things that I want to highlight. So first, look for a single ingredient product that's approved by your physician. So some products will contain the specific ingredient that you're looking for, but then they'll have a laundry list of additives that are added to that product. So you really want to stick with a single ingredient product if you're able. You also want to make sure that the label specifically shows the dosage of each specific product. So this is really important. You want to know the dose of what you're getting. So, you don't take something and you think it's your daily value. You need to take 2 tablets, but really you should only be taking 1 because in that case, you'd be getting double the dose that you really needed. You also need to make sure that a brand is deemed trustworthy. So how would you do this? So to help guide you to these brands, there are certain certification seals or marks from independent third-party organizations to look out for. So like I said, these supplements, herbal supplements, are not regulated by the FDA, but some of them are regulated by a third party. So things to look out for: the U.S. Pharmacopoeia Convention, which is the USP, as you can see on the screen, seal is a good indicator that this has been vetted through a third party. There's also the Good Housekeeping Research Institute, and then consumerlab.com is also a good way to check if these products have been vetted through a third party. All right. So now we're going to jump into discussing specific herbal products that are commonly used. So the first class of supplements that we're going to look at is antioxidants. Antioxidants are found in many different foods. Common examples are vitamin C is found in a lot of citrus foods, and then sometimes found in different grapes and red wines, things like that. So antioxidants work to eliminate excess harmful substances in the body. They have been shown to have benefits, including but not limited to reduction in risk of cancer progression by eliminating excess harmful substances and reduction in harmful substances mediated adverse events. So there are risks, though, especially to those who are undergoing cancer treatment, and there are some controversies to consider here. So namely, like I said, antioxidants work to eliminate foreign substances in the body and essentially attack those substances. So chemotherapy is a foreign substance to the body. So therefore, if you're receiving chemotherapy and taking antioxidants, these antioxidants may actually make your chemotherapy less effective. Also, the antioxidants' goal is to protect your body, so it may end up actually protecting those cancer cells that the chemotherapy is trying to get rid of. So overall, antioxidants actually lack an established benefit for cancer patients. So all that to be said, the question becomes, how can I safely approach antioxidants while on chemotherapy? And what we do know is that the amount of antioxidants that are found in foods in a healthy, balanced diet is safe. So in fact, your physician may encourage these antioxidants found in a lot of different fruits and vegetables. So if you're taking in antioxidants through food, that's fine, but you just don't want to take a product that's specifically for an antioxidant. All right. So next we're going to talk about vitamin D, and it's extremely important and unfortunately something that a lot of the population is deficient in. Not just cancer patients, but people across the board are deficient in vitamin D. So the darker your skin tone, the harder it is to maintain adequate vitamin D levels, because vitamin D is not made naturally in our bodies. Some of the sources that we can get vitamin D from are sun exposure. Specifically, direct UVD light is the best source. But as we all know, overexposure to the sun can cause harmful effects. So we want to limit sun exposure. But one thing to keep in mind is that no studies have shown that sunblock prevents the creation of vitamin D. So always be sure to wear sunblock, especially because many anti-cancer treatments make you more sensitive to sunlight. So always wear your sunblock, but sun exposure is the best way to get a vitamin D. But obviously, like I said, don't overdo it. There are a few foods that naturally contain vitamin D, not many, but there are a few. And that's the reason why so many people are deficient, is because it's not this vitamin D is not, we don't get that from our diet naturally. But some of the foods that do contain it are on the slide. So the flesh of fatty fish like salmon or tuna is a great way to get this. And then fish liver oils are also common sources that we find in food. Small amounts of vitamin D can also be found in beef liver, cheese, and egg yolk. Some products will have a label that says fortified with vitamin D, which of course just means that it's been added into that food, which is totally fine. With vitamin D, we are targeting a level of greater than 30. And with respect to all the anti-cancer benefits, we know that healthy vitamin D levels can have many benefits that contribute to decreased risk of cancer. And this has been validated in certain types of cancer, such as colorectal, breast, and prostate. So having an adequate vitamin D level is really important. If you haven't had your vitamin D level checked, I would definitely recommend getting that checked and then starting a supplement if needed. There's also some prescription meds if you need a higher dose that your provider could prescribe to you as well, if you needed it based on your level. Next, I want to touch on turmeric, because this is one of the supplements that we always get questions on. So turmeric is another natural product which has received some attention in recent years, which is probably why we get all the questions about it. It comes from a plant native to Southeast Asia, and it's used in foods such as curry. And it's what gives curry that bright yellow color. It's also used in dyes because of that color. and it's used in some medicines, herbal supplements, which we're going to discuss. So the active ingredient in turmeric is curcumin, I think is how you say it. Curcumin has many potential benefits, including anti-inflammatory effects. It has antioxidant effects, as well as antimicrobial and antiviral and anti-diabetic effects. In certain cancer types, it is found to have specific effects, including decreases in PSA levels in prostate cancer and reduction in some of the skin irritation that people see from radiation, especially in breast cancer patients. So all that to be said, there are some precautions that need to be taken with turmeric, especially with patients with cancer and those receiving chemotherapy. So first, turmeric interacts with many medications, and there are established interactions with some chemotherapy agents that may affect the safety and efficacy of those of that chemotherapy. So turmeric may increase the risk of kidney stones as well as cause some skin problems. Further, one of the major effects of turmeric is the antiplatelet or blood thinning effects. This is a major interaction for patients receiving chemotherapy, because chemotherapy can also have platelet lowering effects. And when your platelets are low already, and then you add something on that's going to have an antiplatelet effect, a blood thinning effect, you do increase the risk of developing a bleed, which can be a very, very serious thing that happens. So we want to avoid that if possible. So in summary, turmeric is okay in small amounts in foods for flavoring. So if you're eating food that has turmeric in it, that's fine. Those levels are not high enough to cause any harm, but it is not recommended to take large doses of this in the form of a supplement. And then to evaluate your specific situation, always consult your physician and ask them. But the general recommendation is to avoid supplements with turmeric. So this is very important to address because CBD oil or cannabinoid oil products are all over the place these days. So this comes in many forms: oils that can be dropped under the tongue, roll-ons that are applied to the skin, or even solutions for vaping. Some producers extract the CBD oil and add it to foods to create edible products as well. So what is CBD oil and how does it differ from marijuana and hemp? Marijuana and hemp are both varieties of the plant, the cannabinoid plant, the cannabis plant. So both contain cannabinoids, the CBD, and then also the THC, which are the two most common known active ingredients. So the main difference is that hemp, it has far less THC than a typical marijuana plant. And unlike THC, CBD is not a psychoactive agent. So there's less possibility that it will cause the mental confusion, drowsiness, or hallucinations that come with THC. There is no evidence that CBD can cure cancer. And that is something that I feel like is advertised. CBD can cure cancer. There is no evidence to support that. And it's hard to say if CBD oil can even alleviate some of those cancer symptoms or cancer treatment side effects, because the studies are very mixed and the studies are not standardized. There have been reports that CBD may be helpful for nausea, vomiting, anorexia, as well as neuropathy, anxiety, depression, or insomnia. But again, this has not been established in studies. And they did do a study that compared CBD compared to some of the other anti-nausea products that are on the market that are prescription. And they have not been shown to be superior to conventional anti-nausea medications and are not recommended to be used in therapy. The biggest concern with CBD products is that they are not regulated by the FDA. Quality, cleanliness, and regulation are big concerns with these. Because these products are unregulated, it is hard to know how much CBD is really in any given product. And certain CBD products have been found to contain significantly less or significantly more CBD than advertised. And in fact, a study found that 70%, that's a huge percentage, 70% of CBD products sold online are mislabeled. Trace amounts of THC have also been found, and THC, like I had stated previously, is that agent that gives you those the mental drowsiness, hallucinations, those type of effects. There have been trace amounts of THC found in CBD products. So overall, there's still a lot to learn about these products, and always tell your healthcare team if you're using a CBD product, but we recommend that we avoid these products, and there are different things that can be prescribed if you're using this to alleviate certain side effects. There are different options that may be better for you. Next, we're going to talk about over-the-counter products for the management of adverse events caused by your chemotherapy agents. So one of the biggest things that people think of when they think of chemotherapy is nausea and vomiting. So the most popular over-the-counter products that have been noted to help with this include ginger, vitamin B6, and CBD products, which we just discussed. So in regards to ginger, clinical trials have shown that 0.5 grams to 1 gram daily is effective in reducing chemotherapy-induced nausea vomiting. So clinical trials evaluating higher doses found no difference, and these doses may actually potentially worsen the nausea and vomiting. So 1.5 grams to 1 gram is really where you want to stick with ginger, and that's a daily dose. And then, as with other over-the-counter products, there may potentially be some drug interaction. It can impair the absorption of other oral meds because sometimes this, may cause diarrhea or something like that. So always just let your healthcare team know if you are taking high amounts of ginger. Vitamin B6 has been shown to be effective in clinical trials with doses of 25 milligrams orally once or twice a day. But again, ask your healthcare team before adding this on, but that may be a good option. And then, as previously discussed, there are claims that CBD products help with nausea and vomiting, but there are several things to consider, which we just discussed, mainly being that these products are not regulated, and they do contain they may contain higher or lower doses than what's actually advertised. And with these products, smoking or vaping should absolutely always be avoided. And the reason for that is because smoking these products can cause fungal infections in your lungs, which can be fatal. So that smoking or vaping should absolutely be avoided. And then some other helpful hints to help minimize nausea and vomiting include avoid caffeine and smoking. Stay hydrated, which I know can sometimes be difficult when you're going through chemotherapy, because if you're nauseated, you don't want to drink water, you're just not feeling good. But if you can, try to take little sips of water throughout the day, because overall that will help your nausea. Regarding chemotherapy-induced peripheral neuropathy, or better known as damage to nerves in the periphery, and when we say periphery, we're referring to your fingertips and your toes. The first signs of neuropathy can be tingling or sensitivity to temperature in those areas. So this can sometimes be a sign of permanent nerve damage. So it's important to let your healthcare team know if you're experiencing these side effects, because a lot of times this is an additive side effect. So once you start getting it, as you get more and more chemo, it can become worse. So as soon as you notice this side effect, if you do experience it, definitely let your healthcare team know. So in 2014, guidelines were released that stated no agents could be recommended for prevention due to lack of evidence. So in considering specific options, some things such as fish oil and vitamin B6 complex may or may not be beneficial, but evidence is definitely limited, which is unfortunate. The following agents should be avoided because they have not seen any evidence, and they may actually do more harm than good. And those are listed on your slide. what to avoid there. So as you can see, IV calcium and magnesium are listed on agents to avoid. So I just want to mention this because your healthcare team will likely be drawing your levels, your blood levels of these electrolytes. And if they are ever low, then your healthcare team will replete them up to healthy levels. But what we don't want is taking massive amounts of these electrolytes, because they can potentially worsen your peripheral neuropathy. Other non-pharmacologic options that may help with this issue include acupuncture. Exercise can help improve blood flow, which may help with this side effect as well. And see if you can incorporate these different things into your lifestyle if possible. In consideration of other side effects, specifically cancer-related fatigue, we see that ginseng, coenzyme Q6 or Q10, I'm sorry, and others can have claims of benefits, but none of these have been validated by strong studies. So same for insomnia. There's valerian root, melatonin. They have claims of benefits, but none have been shown to have really strong results. You may have to take into consideration side effects before putting these products on. And again, these could be an option, but need to consider the full picture. So it's something like chamomile tea, which may help with insomnia, may be a good option. But again, looking at the package to make sure that it's a single product ingredient and you're not getting a ton of extra things added on. So always make sure, or try at least, to get a single ingredient product. And then again, for these, the evidence, there are strong claims out there, but the evidence is not strong for any of these products. So some of the major things to consider with products is herb-disease interaction. So as previously mentioned, some herbs, as seen on the left side of the table or left side of the screen, can have antiplatelet or blood thinning effects. And these effects are increased with chemotherapy, or if a patient is on another blood thinner like Xarelto or Lovenox. So these would need to be avoided. Some other herbs have hormonal effects. These include isoflavonoids. So these are found in many soy products. And these products produce a weak estrogenic effect and may need to be avoided while receiving chemotherapy. Another concern for over-the-counter products is that they can change the effective dose of oral chemotherapy by affecting how a medication is absorbed in the GI tract. So for example, select oral chemotherapies require a certain stomach acidity to be absorbed. Prilosec, also known as omeprazole, or other PPIs that are on the market, so pantoprazole, which is Protonix, there are others, they're commonly used over-the-counter products. These are used for GERD. So acid reflux is another name for that. Sometimes it's called heartburn. But these medications, they work by decreasing the amount of acid in the stomach. So this means that a patient taking Prilosec or one of these other medications, you may actually, if you take that and then take your chemotherapy, oral medication, you may actually be getting a lower dose of your chemotherapy than what is actually targeted by your oncologist. So these over-the-counter products should be avoided. Sometimes there are ways that if you're having a lot of heartburn, acid reflux, and you need to take one of these medications, there are ways to time it so that it doesn't affect your oral chemotherapy. You take one in the morning and then one 2 hours before, 2 hours after, but your healthcare team would need to assess that. So again, very important to get your healthcare team involved before starting one of these medications. Aloe vera is another example of this. So aloe vera juice or other products has the potential to decrease your GI absorption because it can act as a stimulant laxative and cause diarrhea. And if you're having a lot of diarrhea, things are moving through your GI tract quickly, you may not be absorbing as much of the medication as is targeted. Grapefruit juice is another commonly used food that affects medication. So this is grapefruit and grapefruit juice. If you're on medications, always check to see if grapefruit will interfere. We typically tell patients avoid grapefruit juice and grapefruit while undergoing cancer treatment. It's kind of a weird thing people don't think about, but grapefruit does interact with a lot of medications. It actually works on the main pathway that a lot of medications are metabolized through. So, and the reason for this is that it stops those certain enzymes from working. So this results in increased levels of your medication. And if you're having increased levels of your medication, then that means increased risk of side effects. So other things that potentially can cause this, pomegranate juice, cranberry, really citrusy fruits can sometimes cause this, but grapefruit is one, just avoid it altogether. And it even just a little bit can cause this interaction. So just avoid it. St. John's wort is a commonly used supplement with claims to help with mild to moderate depression, anxiety, and sleep problems. So it's commonly used in the cancer population. But this supplement has extensive drug interactions. It's another one like grapefruit juice. It has a ton of interactions. It affects the drug levels of many different medications. So absolutely avoid this. St. John's wort should not be taken while you're getting treatment for your cancer. So to finish up this presentation, I want to provide some resources for everyone to use. So I know there are a ton of claims out there and so many different products. So this is a good place to start if you have any questions. I tried to focus today on just the most common supplements that I see people using. And sometimes, you know, the ones that people ask about the most because they hear these reputable claims about them. But like I said, a lot of the times it's actually not coming from a reputable source. So it's important to know your resources and know where to look. So I'm going to go through a few of these. And these are great. These are validated websites or resources. So definitely great places to go. So the first is the Memorial Sloan Kettering Cancer Center about herbs, botanicals, and other products. And you can just Google that and it pops right up. It's the first one. And on this website, you can type in the supplement that you have questions about, and it will pull up a clinical summary of it. So other helpful resources, Natural Medicine's Comprehensive Database. This is a great place to check natural product effectiveness, as well as it has a drug interaction checker, which is great. The National Center for Complementary and Integrative Health. So this is a great one. That we actually use a healthcare team to look up specific chemotherapy interactions and agents. So that's a good one to use. And then the FDA website also has some tips that you can use. But the best resource, I think, is really your healthcare team. And like I said, even if you look something up on one of these websites and then it says that it's safe, definitely before you start taking anything, ask your healthcare team. So that, because they know your full picture, they know your history, what medications you're on, what other maybe interacting health conditions you may have. So it's always best to consult your healthcare team first. And like I said at the beginning of this presentation, if you take anything away from the presentation today, that is the most important. All right, so at this time, that concludes our discussion, and I'm going to turn it back over to Katie for any questions.
Thank you, Kelly. That was a lot of great information. We now invite everybody to enter questions into the program chat box. We already got a few good ones, and then we're going to start off with this one, Kelly. At the beginning of the presentation, I know you talked about Tylenol and acetaminophen. There is a surprising amount of over-the-counter medications that do contain acetaminophen that I don't think people would expect, like Sudafed, Dayquil, Benadryl. Is there a certain milligram amount or a general range that's acceptable, or should people just avoid any product containing acetaminophen?
So in general, the daily maximum amount of Tylenol is 4 grams or 4,000 milligrams. And this is basically 8 tablets of the extra strength Tylenol, over-the-counter Tylenol extra strength. So that's just general population is the max, 4 grams. But I would say when you're actively getting chemotherapy treatment, I would avoid Tylenol unless okayed by your healthcare team, because it can mask a fever, which is what we don't want to do while someone is immunocompromised. And as we all know, chemotherapy can potentially make a patient immunocompromised. So I would say avoid unless your healthcare team says it's okay. But if they do okay it, 4 grams is the max dose for the day.
Okay, and when you do have a headache or something like that, when you're at the drugstore, who's the best person you think to talk to navigate through an alternative? Is it making a phone call before you're there, or maybe talking to a pharmacist?
Definitely the pharmacist at your local drugstore is a great resource and a super convenient healthcare worker that you have access to. So I think that's a great option. But letting them know, as I've said previously, just letting them know about all the medications you're on, your whole clinical picture, is probably the best way to go.
Okay. One of the other questions was about oral probiotics. Would you recommend or advise against using oral probiotics while receiving chemo? And then what about foods containing probiotics? Do those fall under the same umbrella?
So that is a great question that we actually get all the time at the hospital. So avoid probiotics. And the reason for that is because while patients are in an immunocompromised state and you're taking a probiotic, which is essentially it's bacteria to help your gut health, but it is bacteria. So what we can see in an immunocompromised person is that sometimes that probiotic, those bacteria can translocate into the blood or other areas of the body and then cause a very serious infection because your body just doesn't have the ability to fight off that infection. So avoid probiotics while being treated for your cancer. And that does apply to foods. So yogurts that have a lot of probiotics in them, avoid during cancer treatment. That's a great question.
Okay, and during the presentation, I know you talked about turmeric and you said some amounts are fine. What do you consider to be a high dose of turmeric, and what could be an acceptable level?
So the actual milligrams I would have to look up to see, but I'm happy to, if whoever asked that question wants to drop their email address in the comments, I can look that up and definitely get back to you. But in general, the recommendation is any amount that's, if it's cooked into your food, then that is a safe amount. But what we don't want is, a supplement taking just turmeric. But if you're taking it just as part of your balanced diet, then that is an acceptable amount.
Okay, and kind of speaking more about the preparation of some of these, I know you talked about ginger can assist with nausea. Do you recommend people take ginger in an oral pill form, or is there a preferred way that you find more effective to combat nausea?
So I've seen actually a couple different things just in my experience. There are some ginger lozenges that people have done really well with. I had patients who actually they got them, I believe, on Amazon. It was a single product, but it was a lozenge that people would take, while they were nauseous, that worked well. But taking it orally is fine as well. Dried ginger is a good option as well.
Okay. Another question came in, what types of stool softeners are best to avoid constipation, and should those be taken at the same time as other medications, or should you try to schedule them separately?
So good stool softeners that we typically recommend to patients, Docusate, that's Colace is the brand name, is one that we typically recommend, which can be given or taken over the counter as well as prescription. But that is a good one, Docusate, and there's a combo product, Docusate with Senna, is a good option. to help combat constipation. And those are typically safe, and they can be taken at the same time as other medications.
Okay, thank you. At the end of the program, you kind of talked a little bit about vaping. Can you talk about what are the effects of vaping nicotine?
So during cancer treatment, we recommend that people don't smoke or vape. And the reason for that, whether it's nicotine, CBD, any of those, is because the risk of fungal infections. And this is a real thing. I have actually seen this happen to a patient. It's horrible. A fungal infection in your lungs is a very serious infection that requires you have to get a lot of antifungal medications, which are not super easy to tolerate always. But what we worry about is a fungal infection developing in the lungs. And like I was saying, a fungal infection in general, but especially in your lungs, it's very difficult to treat just because of the nature of a fungus. So we really recommend that patients avoid smoking or vaping of any sort. I've worked with patients before, they're a chronic smoker and they're diagnosed with cancer, and telling them, okay, you have to stop smoking. There are different agents that we can use. There are patches that provide nicotine for the patients, like a nicotine patch that can be given through prescription or over the counter, is how we would navigate that. But we really try to avoid any sort of smoking for patients because of that risk of fungal infection.
I think going back to your point of talk to your healthcare team for possible alternatives.
Absolutely.
And then another question, can you speak to moderate use of alcohol and how that might operate?
So this is a great question because it's something that comes up a lot. With alcohol, so alcohol has blood thinning effects. So we do tell patients to avoid alcohol. It interacts with some medications, but the other thing that we really worry about, besides the blood thinning effects, is that alcohol can irritate, or it does irritate your liver. So if you were to have a glass of wine or something, and then the next day you get your labs drawn, that will be reflected on your labs. Your liver function test that we look at will be elevated. And you would say, oh, from one glass of wine, yes. It does affect your labs. So potentially you could be looking at, okay, well, your healthcare team is evaluating your labs and seeing that your liver enzymes are elevated, and then may contribute that to your chemotherapy treatment, and then make adjustments to your chemotherapy that are actually not needed. So that's just one instance. But I would say for that reason, for the liver toxicity, as well as the blood thinning effects, it really should be avoided during your treatment. And then also it does interact with some medication. So I would say alcohol during your treatment should be avoided.
Okay, thank you. This one talks about radiation treatment. I think towards the end of the presentation, you mentioned aloe vera. I've heard it's not, a participant shares, I've heard it's not suggested to use aloe vera to treat burns from radiation treatment. Can you speak to this a little more, and is there a suggested alternative?
Yeah, so radiation can cause a lot of skin burns, painful burns on the skin. So they actually did a study that looked at aloe vera and compared it to just your traditional plain lotion. And they found that aloe vera the plain lotion was superior to aloe vera. Aloe vera didn't help patients. And they looked at patients during radiation, then for 2 weeks after. So aloe vera should be avoided after a patient gets radiation because it really just doesn't have any benefit. And a good alternative is plain non-fragranced lotion is a good option. Aquaphor is usually what we recommend to patients. It's a good non-fragrance is really the biggest thing. And then also making sure you look for a product. Some aloe vera products actually have some alcohol added into it, which as you can imagine, if you're applying that to open wounds and burns, it's gonna sting horribly. So another reason to avoid aloe vera, but making sure that the products that you're getting are fragrance free, don't have any alcohol components or anything like that in them.
Right, thank you. It sounds like really looking at more of the ingredients too of what we're all taking and learning more about that.
Yes,
This one is
definitely.
a question post-treatment. I've completed my treatment but have now taking tamoxifen. How do I know if there are any over-the-counter medications that may reduce its effectiveness?
So great question, because tamoxifen, people can be on that for a long period of time. And it does work. Tamoxifen actually works through one of those major pathways that we were discussing earlier. It's processed through your liver. So there definitely are interactions that can happen with it. So I would say best resource, so a good place to start if you're just looking for yourself is this resource that I have listed on this slide. That can help look at drug interactions. So it is the second one on here. So you can pull that up, just Google it, that, and it'll pop right up, but you can check for interactions yourself. But I would always discuss with your healthcare team before changing anything, because, all the information may not be there, or there may just be a part of the clinical picture that's missing, that your healthcare team can kind of fill in those gaps. So I would say check there first if you're just at home, and then definitely follow up with your healthcare team. And when I say your healthcare team, I'm referring obviously to your physician, of course, but then also the mid-level providers that you may be seeing, your pharmacist as part of the team. And a lot of times oncologists work directly with pharmacy. So they may be able to give you, if you call their office, they may be able to give you a direct resource to a pharmacist that can look through your profile and things and help you make a decision.
Thank you. We have a couple more questions. A participant asks, can you speak a little bit about ashwagandha?
So ashwagandha, so I actually have a patient story about this. Obviously, I won't reveal any pertinent patient information, but we had a patient who took ashwagandha and actually had to be hospitalized because it affected their liver. And their liver function tests were honestly some of the highest I've ever seen. So that is to say, these products are marketed as safe, but that medication or those supplements in general are not vetted by the FDA. So it could have additive products, it could have all of these extra things in it that it's unregulated. So the most important thing when getting a supplement, like I said, is the single ingredient, but also making sure it has been vetted through a third party, because that medication, it has, looking up drug reports and things, or case reports, there were reports that medication can cause some liver toxicity. But for that particular patient, who knows why his his liver function test, LFTs is what we're looking at. But his liver function test went through the roof. So it could have been that medication had some additives in it that we didn't know about, or it could have been that he had taken too much of it. Maybe the dose that he thought he was taking was not appropriate. But I would say avoid that medication, especially while you're going through cancer treatment, because we don't want to see that it's affecting your liver in a way that's, interacting with your other medications. Because as I was saying before, we could see that your liver function tests are elevated, and then we now have to hold your chemotherapy because it's not safe for you to receive your chemo med while your liver function tests are that high. So it's doing more harm than good. So I would say that's one that to avoid, but again, talk to your healthcare team.
All right, thank you. And I think probably our last question, with the summer months coming up, I know you were talking about vitamin D earlier in the presentation and enjoying sun, but within limits. Can you provide some parameters as far as what's healthy sun exposure it looks like?
So this is very patient specific. So some chemotherapy agents make you more sensitive to sunlight. So really any sun exposure is can be harmful, can cause burns. So for those particular instances, we recommend that patients, you obviously can still go outside. We want people to get fresh air, but wearing a wide brimmed hat to help protect your face, wearing sunscreen, long sleeves, those type things. Some chemotherapy agents don't have that particular side effect. So I would say just sun exposure, make sure if you're going out into the sun, there aren't necessarily hard cutoffs like 1 hour of sunlight, but I would say just make sure that you're aware of how much sun you're getting, always wearing sunblock. Because like I mentioned in the presentation, there are no studies to suggest that wearing sunblock will inhibit you from absorbing that vitamin D. So always wear sunblock, but just be extra aware of, watching, making sure you're coming inside or putting on those extra layers or the hat or whatever it may be if you start burning.
All right, and I think earlier you were talking a little bit about neuropathy. I do want to do a little plug for, we have a couple neuropathy videos on Cancer Support Community Atlanta's video library, so you can find that tab at our website, cscatlanta.org, and watch a few recordings on some neuropathy exercises and some information there on that. I also want to remind everybody a recording of today's event will also go up on that video library tab, and you should also be emailed a copy, so be on the lookout for that. Thank you so much, Kelli. I feel like so much great information and some great resources here. I'm going to be on the lookout, I think, looking at the ingredients more of the things I'm taking too. I feel like it's not something you're in the routine of, but something that we should all be. So as we wrap up, I just want to throw it out to you to see if you have any kind of final thoughts to share.
I just want to say thank you to everyone for coming to this presentation. I, myself, Katie, and all of your healthcare team, we really want the best outcomes for everyone. And if there's ever any questions, your healthcare team, I'm sure, is more than happy to help you in any sort of way. So always reach out to them. I know that it can be a tough time as you go through your cancer treatment and things, but just know that you have people on your side, and we really want to see everyone succeed and do great and have great outcomes. So again, if there's any questions, always reach out to your healthcare team, and best of luck to everyone.
Thank you, Kelli. And for more information on any of our free oncology support programs, again, please visit our website, cscatlanta.org. Thank you, Kelli, and thank you everybody for joining us. We hope to see you soon. Take care.
Thanks, guys.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.